No mother should die while bringing. We are not doing very well. We're losing a lot of mothers in our facilities. No mother should die while bringing. We are not doing very well. We're losing a lot of mothers in our facilities. And I want us to clap for the people from the former Central Kenya. Can you clap for them? The maternal mortality and new child born rates are very minimal. Those of us who come from Eastern, Western, Pastoralist, Nyanza, Coast, we have some work to do. And I am ready to lead from the front. I'll work with the leaders. That we are losing more mothers in those regions than any other part. Honorable Speaker, let me talk about the Kenyatta National Hospital, one of our world-class milestones. When I founded Kenyatta, and I'm happy to report today, the chairman of the Kenyatta National Hospital, the former Secretary General of Kenya Red Cross, through his corporate network, today we are refurbishing 9 wards in Kenyatta at a cost of 270 million, paid for by the corporates, banks. He went to Equity, he went to KCB, he went to many other organizations, and today they are refurbishing at a cost. Today, Kenyatta National Hospital has established the state-of-the-art HLA lab for organ transplant matching, ending our reliance on expensive foreign laboratories. We are not sending now tests to South Africa or to the CDC Atlanta. Kenyatta National Hospital is doing a lot to our community. Record-breaking surgeries you watch in the news every day. Beyond our borders, we want to position Kenya as a leader in global health security. And we have formed the Kenya National Public Health Institute. We have expanded our laboratories and our emergency operation centers. We want to build a resilient system that can detect and respond to pandemics long before they reach our doorsteps. However, Honorable Speaker, these gains remain fragile without a very strong intergovernmental synergy. And I want to urge the National Assembly to ensure that health remains a whole of government priority. Health security is inseparable from the work of the Ministry of Interior, ICT, Education, National Treasury, and many others. Honorable Speaker, let me come now to the legislative agenda as I conclude. We laid the foundation and we have secured the standard of care. And I wish to bring to your attention that there is a bill before the House called the Quality of Health Care and Patient Safety Bill 2025. This bill is critical bill is already before the House. It went through first reading on the 14th of August 2025 and has been committed to our Departmental Committee on Health. This bill will guarantee the safety for every Kenyan patient. It establishes legal framework to ensure that the care paid for by SHA is care that cures, not care that harms. And I want to give an example. When there are 2 mothers, pregnant mothers sharing a bed, that is not care. Do we agree? When we have a mother or a patient, even male, on the floor of a hospital, that is not care. Particularly in a cold place like Nyandarua. Do you know, have you asked yourself why there are no more Kenyans sharing beds? Do you know what we have done in the system? Every hospital, in their license, they have their bed capacity. So if your hospital has 50, we will not allow you to admit more than 50. 2, in the old NHIF, the 2 mothers who are sharing the bed and the one on the floor, both the 3 of them were paid by NHIF. So they were making money. Now we have said, and we watch the bed occupancy. If I had the Digital Health Agency CEO, we could have shown you, a good example, Kenyatta Hospital. Kenyatta Hospital ideally is supposed to have a bed occupancy of 1,800. But Kenyatta was admitting 2,200, extra 400. Today, if you go to Kenyatta, you will not find two mothers sharing a bed. But what I am doing is the system and administrative. I really want you to do that in legislation. We define care in that bill. A care of a patient, the dignity of the patient, the safety of the patient, the ethical standards of the patient are all defined in that bill. I really want to ask Honorable Speaker and members and our committee to fast track that bill in the first quarter of this year. It will really help us help our patients. Then we have a number of other bills that are in Parliament. The Health Act Amendment, the Public Health Act, the Tobacco Control Act, the Cancer Prevention and Control Act, the Food, Drugs and Chemical Substance Act, the Pharmacy. All these are amendments. They will really help us if they are fast-tracked. Honorable Speaker, finally, to sustain this momentum, we require your budgetary support. To clear the pending claims and ensure that seamless operations of free primary health care, we urgently require, we have already told the National Treasury, they have committed to us, but the Leader of Majority and the Chair of Budget can help us, them to release the 5.9 exchequer release so that we can pay facilities for the month of October, November, and December in the primary health care, in the dispensaries, and in the health centers. But they have said they will pay before the end of this week. We also wanted the projection deficit of the PHC, and the Chair of Budget is aware, is about 11.9 billion, and we want it to be factored in. Between now and June, we want it to be factored in the supplementary budget. When we were looking at the maternity package, we realized the people who design SHA and UHC, they have left a very component. There are places where our mothers deliver in health centers. They deliver even in dispensaries. And sub-county or level 4 hospitals are very far from them. And after that discussion, and we did a paper, the summit chaired by the President, the Council of Governors, we have agreed now our mothers, because we want to reduce the maternal mortality, maternal and child mortality rate, we have asked now to be given more resources of 2 billion so that our mothers can now deliver in health centers and in some dispensaries in some of our constituencies. Honorable Speaker, and this is just to save our mothers and our newborns. Honorable Speaker, I come with the very senior members of my ministry. If you allow me, PS Oluga is busy chairing. I left him in Nairobi to chair another workshop. I have PS Mary Mudhoni of Public Health and Professional Standards. I have the first Director General under the new Constitution of Health, Dr. Amoth, Dr. Masi Mwangangi, CEO, SHA. One of my directors from KEMSA, Operations, and then Terry Rotich, who's the head of legal in SHA. I think those are the ones. Yeah, I have another team, the gentleman at the far end, the two gentlemen are two directors with Social Health Authority. Honorable Speaker, just to conclude, the state of our health care in our country is transforming. We have moved from a deficit-ridden NHIF to a more surplus-generating SHA. We have moved from a paper files to digital superhighway. We have moved from volunteers to paid community health promoters. This transition is unprecedented. It is working. is what President Ruto and his administration have promised, and I request your continued support as we anchor these gains in law and practice. Thank you very much, Honorable Speaker and members. God bless you, and I'm ready to answer. Just to, in case members have issues with the headline of today, on the headline, the 11 billion are the rejections I have told you. Those are money lost in the sense that they have claimed we have found them. They are remitting. Some of them are going to court. Some of them have agreed to return back our money. And we have not finished. We have, I don't want to, there are some things that belong to the criminal justice system. I don't want to speak for. I have the whole list. The biggest junk is the private hospitals, followed by the county hospitals, followed by the National Referral Hospital, including Kenyatta, MTRH. The lowest is with the faith-based hospitals. We have the names we can publish. There are rejections. They claimed for services they have not offered. And they have done all that I was telling you. And I am sure that many people, including those who are criticizing me, some of them, this morning they sent me a text message and they said those people must be prosecuted and they must return the money. You cannot eat the money that belongs to a patient in Kenya. Thank you, Honorable Speaker.
Thank you. Thank you, Waziri. Honorable members, you've heard the minister is with his team, Rachel.